Okay, Dr. Ben, let's start. We've heard that all over the country there's a disproportionate effect on Black and Brown communities of coronavirus. What is it like locally?
Well, there's what we're seeing and what we're not able to see. In some ways, there's still such a lack of good data that it's actually hard to get a full picture of everything. But what we do know is that for communities of color and non-English speaking communities, they are harder hit with severity from this coronavirus, in addition to the other ways in which they're affected around the issues of housing and other social and economic components that are just really devastating families everywhere, but especially in these communities of color and non-English speaking communities.
So when you talk about the economic impact, tell me why that falls disproportionately on these populations.
Well, it feels like sort of getting hit from every angle, right?
Yeah.
A lot of our families are actually forced to continue to work during this time in various jobs that are either considered essential or that are essential for families, which increases their exposure risk, which then means they're more likely to get sick. And then when they are sick, as we know nationally, more likely to have more severe illness. So that component is really important. To other families, the loss of income that's affecting rent and housing has been really severe. And if it's not yet hit every single person, then the worry of it hitting these families that already deal with so many other kinds of stress is just enormous. It's really devastating.
What is the mental health toll of this reality?
Well, we're seeing many different forms of the mental health toll. We talk to lots of kids via telehealth or sometimes here in clinic, and they talk about just how much worry they carry and how they try to figure out how to balance their lives in this time of uncertainty. We hear parents who are stressed over everything from trying to be teachers themselves to managing a sort of full-time, full household to wondering what it's going to be like even as restrictions get lifted.
You're not only a physician, but you've been heavily involved in our community for a long time in ways that we really appreciate. And I'm wondering how you're thinking about this balance of what we need to do for public health and what the economic realities are for people who are facing financial ruin at times like this.
I think these are the questions of our time right now. What I will say from my perspective is I do think that some of the economic decisions to reopen and reignite economic activity may have the risk of falling disproportionately on the backs and shoulders of communities of color and the non-English speaking communities in a severe way. Some of the decisions I think are being made at a broader economic level, and I'm not an economist. I won't pretend to speak for those factors, and I really understand the struggles that people are going through. What I do feel strongly about is we already know how difficultly impacted our communities are, communities of color, and they are going to get hit the hardest by the reopening if we end up with another surge in cases.
Now, is part of the reason why this is happening disproportionately historical lack of access to health care, comorbidities, that kind of thing? Explain what is behind this.
I think I've said what I've heard a lot of other people say with various forms of analogy, but to my mind, the pandemic that we're facing right now has just put a yellow highlighter pen on all of the kinds of issues our society has faced for hundreds of years. These are just elevated and there are exclamation points after them. We see them more clearly, and yet they are components of the same kinds of challenges communities that our clinic serves have been facing forever, generationally. So I think that's a big piece of the picture we're talking about, which also means to me that if we want to talk about solutions and really helping us do a better job during this crisis time, in addition to in the future, then the solutions have to really be based on the issues that were present before the pandemic showed up.
Let's talk about that a little more, because one of the things we want to do is look to the future. And it seems to me, as we are seeing these astonishing figures that prove the disproportionate economic and health sufferings of certain populations, we can't leave that unaddressed going forward.
I really hope that this is eye-opening and awakening for us as a society and as communities, as a county and as a state. Um, we have this opportunity right now to decide not to shut our eyes, not to turn away from some of the challenges that I think we all know we've been facing for a long time. This relates to rural communities, right? This relates to other communities that have been sort of pushed aside or have had a lack of support and focus in the past. And we get to see that really clearly. And the question I guess I have for myself, for the people I work around, and for the other folks who really care about making a difference in this world is, how are we going to wake up tomorrow and see a different day? How are we going to commit ourselves to longer term, broader based, and more meaningful solutions, rather than hoping for a return to what was happening in January or last December?
And this applies to us locally. We need to remember that.
Yes, so important. We all bear a responsibility. I bear a responsibility. We all see what we see these days, and we all understand where this comes from, where the roots of it are. This is such a great opportunity in a strange way for us to really decide who we want to be as a community instead of have factors decide for us. If we really could decide, what would we choose? How would we, you know me, I'm a pediatrician, so I have to ask, how would we invest differently in our kids? How would we see our view from a generational perspective instead of from a next week or tomorrow perspective? I think it's a great opportunity, and I hope we have really important conversations as we move forward.
Thank you so much.
Thank you. I really appreciate everything you're doing to shine a light and to create conversations like this, because I think these are the sparks that really help to make for a meaningful change. I appreciate all you do.
Well, for whatever small part it does, we're on it.
Wonderful.
Thank you.